In March 2020, hospitals across Lombardy face a silence doctors feared. On March 8th, Bergamo wards filled faster than charts could be updated. Doctors noticed dying patients whispering the same final sentence. The words were recorded first in the Milan ICU intake note. That note was dated March 10th and signed by Dr. Elisa Conti. Nurses assumed coincidence as case numbers surged overnight. By March 12th, the phrase appeared again in Brescia records. Each patient was unrelated, different ages, histories, and families. The sentence was short, calm, and spoken moments before death. No explanation accompanied the words in early medical logs. An intern flagged the repetition in a shared hospital database. The database timestamp showed identical phrasing across facilities. Dr. Conti requested older audio files from patient monitoring systems. The request was logged on March 13th in hospital IT records. Technicians found 5 matching audio clips from separate rooms. All clips were recorded within 48 hours of admission. The patients had no contact with one another before hospitalization. Family interviews confirmed no shared media or religious guidance. A memo suggested removing patient quotes from discharge summaries. The memo bore the seal of the Lombardy Health Directorate. Investigators reviewed CCTV footage from intensive care corridors. The footage showed patients speaking clearly despite oxygen masks. Lip readers confirmed the same sentence across recordings. The words referenced time ending and a gate remaining closed. Doctors avoided public discussion, fearing panic during lockdown. On March 15th, Dr. Conti emailed colleagues asking for transparency. The email was marked read but received no replies. A similar report surfaced from a hospital in Cremona. That report was filed and withdrawn within 24 hours. Medical staff were told to focus strictly on treatment outcomes. A night shift nurse recorded the phrase in a personal notebook. Her entry was dated March 16th and listed 3 patient names. 2 names later vanished from the official death registry. When questioned, administrators cited clerical overload. A pathologist reported no neurological cause for shared speech. Autopsy notes mentioned intact brain tissue without lesions. The pathologist's report was sealed under emergency provisions. Doctors whisper about shared dreams among sedated patients. Those claims never entered formal documentation. One ward closed suddenly due to unspecified contamination. On March 18th, security restricted access to ICU archives. Hard drives were removed under supervision of regional officials. Staff were asked to sign updated confidentiality agreements. A doctor refusing signature was reassigned the same day. Her personnel file shows a transfer to a rural clinic. Colleagues said she stopped answering calls after April. Patient audio backups from March were declared corrupted. An IT audit found deletion commands issued remotely. The origin of those commands remains undocumented. Local journalists requested records and received denial notices. Funeral homes reported unusual calm among the deceased families. Several relatives mentioned hearing the same words recalled. Those comments were omitted from official death certificates. By March 22nd, internal briefings banned recording last statements. The ban referenced maintaining public order during crisis. Medical ethics boards were not consulted on the decision. A leaked slide presentation summarized the phrase occurrences. The slide ended with a recommendation to cease tracking. Hospitals complied without public explanation. No national inquiry was announced. By early April, the pattern no longer appeared in records. Doctors privately noted patients still mouthing similar words. Those observations stayed off charts and personal devices. The Lombardy Directorate issued a final circular on April 7th. It ordered destruction of unofficial notes and recordings. Compliance confirmations were filed and archived. Whistleblowers contacted abroad researchers anonymously. Their messages described fear rather than certainty. One message ended abruptly mid-sentence. The sender was never identified. Years later, sealed boxes remain in hospital basements. Access logs show no entries since spring 2020. Dr. Connie's name appears nowhere in later publications. Colleagues describe her as having left medicine entirely. The phrase itself was never released to the public. Officials maintain no verified anomaly occurred. Families continue to ask about missing final records. Requests are answered with standardized legal language. No authority confirms or denies the shared words. The silence around March 2020 still persists. Some doctors still remember the sentence without repeating it. They say repeating it feels like reopening a closed door. No document explains why so many spoke it at the end. No record explains who decided it must disappear. The wards have changed, but the memory remains unchanged. Every March, a few staff quietly revisit those nights. They wonder if the words were a warning or reflection. The hospitals offer no memorial or explanation. Only redacted files remain where answers should be. What was said and why is still officially unasked.